And that's the question we're asking you this week. Will you help bring change? You know, we need to put ourselves in the shoes of these mothers. And when you think about our own mother, what would you do to save your mother's life? What did your mother mean to you? And what would your life have been without your mother? And that's what so many kids across East Africa are facing, life without their mother. And not just the child that loses their mother when she's giving birth, but generally these moms leave 4 other kids behind. We really need you to come on board and make a difference and do this for mothers, do this for the future of East Africa. And your gift is going to impact generations to come. We can change it. Call the number on your screen, 1-888-288-0003, or go to crossroads.ca. It's easy to give, and together we can change this. Well, a warrior in the fight for mothers is here with us again, Dr. Eve Nakabembe. Dr. Eve, you're an obstetrician. You also direct the Mother Baby Friendly Hospital Initiative for Save the Mothers, which is really just adopt a clinic, really, is the idea. You know, when mothers are facing the kind of conditions we just saw, when they're giving birth in those kinds of conditions, how do they feel about it? Do they feel like the world has forgotten them? Do they feel that they're not valued by the world and that people just think this is okay?
Those mothers feel like the world has forgotten them, and actually that nobody cares. Does anybody care? Because they are powerless. Like, if there's anything they could do within their power to change their situation, they would do it. I mean, you know the strength of women all over the world. Like, a woman will do anything that she can do to change her situation. But these are situations they find themselves in, and somebody has to help them. Like, they can't help themselves.
And you couldn't imagine a more vulnerable position that you're in than when you're giving birth. You literally are the most vulnerable that a woman will probably ever be in her life at that time. And, you know, what can she do to change it? Well, we are doing something to change it. What are we doing? Just give us a sense.
We are reaching out to these moms. We are encouraging them. We are standing with them. You know, we are telling them that people care, people love you, and people are going to do the best that they can to make sure that you go through this with dignity, with love, with respect, because it's supposed to be a joyous moment, you know. It's not supposed to be a moment where you give up, you get depressed, you surrender. It's a battle. You keep going, you know. So I think for us, like me, every day that I get up and I attend to these moms and I see a mom who has, you know, gone through well, she's felt respected, she's safe, her baby's safe, just that reward, that smile, you know. You have a new baby, you have a new life, and the baby's crying, you're like, God, thank you, you know. So it's very rewarding for us, and it's very definitely rewarding for the moms as well.
And do you have hope for the future of moms in Uganda now?
I have hope. I have a lot of hope for the future of moms in Uganda. I have hope.
And I saw it too, you know, Dr. Eve, going to see village clinics that we're taking on, clinics that you have taken on, and just seeing the difference of the whole spirit of the place, seeing the facilities that are there, the sterilizers, the medicine, the sutures, you know, and just the hope that everybody seems to have. We want to bring that to more and more places, and not just in Uganda, but in Ghana and Tanzania. We're looking forward to partnering with you and expanding it. Thank you for all you're doing.
Thank you too. Thank you for supporting us, and thank you for working with us in helping these really very vulnerable moms, you know. Every morning I see a mother and she is just so happy, she's so grateful. And the health workers, they feel like we are ready to do what we are supposed to do because you're standing with us. We always go to these facilities, and the smile on the nurses' faces, you know, and the doctors are like, oh, you are very welcome. You know, you
love it.
It's very
And that's the change that we're bringing. Thank you for all you're doing.
Well, thank